Hi, everyone. This is Jenna Singleton. I'm the medical advisor for CoorsTek. I'm here with Kim Gorman today. She is a wellness specialist, a registered dietitian with a master's degree in exercise physiology. Comes to us with about 30 years of experience with an emphasis on weight management and sports nutrition. I'd like for Kim to go ahead and share some of her philosophy and how she's currently doing in helping her patients around these topics. And so without further ado, Kim, if you could please go ahead and give us some more of your background.
Yeah, thanks so much for having me today. 30 years seems like a really long time, and I remember earlier on when I did my internship at the Cleveland Clinic, it's kind of how I got my foot in the door here. I remember knowing so much stuff, I had all this information, but the ability to have somebody integrate the information into their lifestyle really became my focus. Later in my 20s, early 30s, when I was mentored by a psychologist. And so I learned the Prochaska's model of changing behavior. And when that happened, I recognized that less can be more. And so I really worked to meet somebody where they're at on their motivational level and what their desired outcomes are, and then help to kind of like a small investment and a big dividend, so we can bite off little pieces but have really big outcomes. And I think that's kind of today what we're looking at in terms of how do we fight something that we may not have control over. So I think today we'll have lots of little tidbits of information that hopefully people can grab onto and find a level of implementation.
I wanted to start with, how should we approach sleep, and what do you think are some of the benefits of getting a good night's sleep?
So in my world of wellness, and I say this over and over and over again, sleep is number one. Then I go to exercise, and then I deal with the diet. Sleep is so significant because growth hormone is our fountain of youth, and our natural production through the course of time, it goes down. And so it's interesting, our population, looking at CoorsTek of people over age 50, because it's a significant change when you get over age 50. And so growth hormone peaks in our sleep. And so the people who are poor sleepers, they don't get that chance to get reset, to get their bodies put together as well as we possibly could. And that has to do with stress as well. So sleep is number one.
Good. And so, Kim, what are some strategies that you can share with us around good sleep hygiene practices?
So the first thing I recommend to my folks is make sure you're on a routine. So your bedtime and your wake time, so you can be consistent. Whatever the waking time is, you want to back it off so that you're in a 90-minute increment. So 7.5 hours is the sweet spot I try to get most of my execs into, because a complete sleep cycle is at 90 minutes. You'll feel refreshed if you can wake up at one of those 90-minute cycles. Then you look at the bedroom. Is it cool? Is it dark? Do you need a white noise, or do you need it completely quiet? Is it free of electronic devices? We know it's a big deal. You got to stay away from the screens. If you are somebody that wakes up in the middle of the night, you don't want to go to your phone or an iPad. You want to get up, sit in a chair, read a book or a magazine until you feel sleepy and you go back to bed. So in terms of your environment, it's really important. Keep the animals out of the room best that you can. The next part would be, watch what you're eating at nighttime. Do not overload your body with calories. You don't want to be full and then lay down. That's when you end up with all the reflux issues going on. So watch out for the large meals, watch out for the caffeine, and you watch out for the alcohol.
Okay, those are great tips. I particularly like the focus on sleep cycles. I don't think we pay enough attention to that as a society.